In my subsequent videos, I will talk about the signs of labor and then the stages of labor. But today, I want us to talk about what goes on in the labor room. Are you a first-time mom? This video is for you. Welcome to my channel. I am Rahel, aka Midwife Rahel. The best gist is here. After you have seen the signs of labor, example, severe uterine contractions, severe lower abdominal pain, severe waist pains, and the rest, all that you have to do is taking a deep breath and say, oh, the process has begun and I will have a safe delivery. Then you take your antenatal book. Remember, because without the antenatal book, the midwife will find it very difficult to take care of you, because the antenatal book contains vital and essential information about you and the pregnancy. So she needs the antenatal book. So when you get to the maternity ward, you meet nice and caring midwives to take care of you. You don't have to be alarmed. They will give you a seat to sit depending on the stage of your labor. The midwife will take the antenatal book, then go through to see your scan. So she will check through your scan and then calculate your EDD, that is estimated delivery date, to see whether the labor is not a preterm. Then she will check the position of your placenta and then some abnormalities. She will check all laboratory investigations, your results. They will give you a bed to lie on your lateral side, I mean your sideways. Your midwife will check your vital signs, that is the BP. She will check your pulse, your respiration. She will check your temperature. All these are very important to be done. After, she will take your blood sample for investigation at the lab to see whether you have the normal range for hemoglobin level, or maybe you might need a blood transfusion, or there are some management that should be done. She has to take your blood sample, and then she will ask you to urinate for her to do some tests. Okay, example, to check urine, protein in urine, to check sugar in urine. It's advisable for you to go to the hospital as soon as you see the signs of labor. You don't have to wait in the house for long. If you do that, it will affect you and it affects the midwife as well. Pending you are lying on the bed, she will ask you to lie at your back. That is the supine position. And then she'll explain procedure for you to understand. She'll tell you that I'm about to palpate your abdomen, so you have to expose your abdomen for me. So when you expose your abdomen, she'll palpate your abdomen to see the line of your baby, and then to see the presenting parts, whether the baby is presenting with the buttocks or the head or any part of the body. And after doing that, she'll measure your abdomen using a measuring tape. She will do that to rule out any abnormalities, to see whether the abdomen is big to be delivered, for you to deliver per vagina, or there is any abnormalities. So she will measure the abdomen. Then she will check your baby's heart rate, that is the fetal heart rate, using a sonicid or a Doppler, and that is it. The one that you see on your screen, that is the Doppler that we use to check the fetus heart rate or your baby's heart rate. And after that, she will give you the findings and then tell you that she's about to do or perform a vaginal examination. That is the point that most women will be like, oh, should I do it? Oh, then there will be some will be shy, others will be anxious. So the midwife will explain procedure for you to understand the need of her doing that, and then she will ask you if you give her the permission if you do, you have to give her the permission, because without that she can't do her work. And some women feel shy to expose themselves, but it's very necessary for it to be done. It's quite painful, but you have to pass through, because without that the midwife won't know what is going down there. So she does that to figure out any abnormalities. Example, if there are warts down there, candidiasis, if the vagina is edematous, is it that dry or moist, is the vagina hot, that can indicate dehydration. Okay, so there are important things to be known. So she has to do the vaginal examination. So the vaginal examination, after examining the outer part, she will put 2 fingers, the first one, then she will add the second one, these 2 fingers, into the vagina, then into the cervix, and to feel the cervix. It's quite painful, but you have to pass through, you have to endure the pain. So she will do that to rule out any abnormalities, and then she will feel whether your cervix has swollen, is it thin, is it in the right position, and then has the board that you see with holes, that is called the cervical dilatation board. And so the small hole that you see is the 1 centimeters, and the big one among them is the 10 centimeters. This board, after she has done with the vaginal examination or the cervical assessment, she will compare to what she felt down there. So she will compare whether when she did the vaginal examination, your cervix has dilated 3 cm. She will compare what she felt there to the board, and then see where you have dilated to. Every woman has to dilate to 10 centimeters before the baby can push through. Join me in my next video, and let's talk about what happens when the cervix is fully dilated, what you have to do. Thanks for watching this video.